Traumatic injuries of the brain occurs when an external force is traumatically injuries the brain classified on the basis of severity, mechanism, and location. Classification of traumatic brain injury according to the severity: mild concussion, mild traumatic injury, moderate and severe. According to the mechanism: closed base injury, closed head injury, penetrating head injury. According to the mechanism: severity, in severity, mild, moderate, severe. In mild, concussion, mild traumatic brain injury, moderate, severe. According to the mechanism: closed and penetrating head injury. Location: according to focal, occurring in a specific location, that is a contusion, typically associated with blows to the head, diffuse focal, that is example contusion, typically associated with blows to the head. Diffuse more widespread diffuse axonal injury, typically associated with accelerated rotational and decelerated motions of the head. Classification of traumatic brain injury according to the severity: Glasgow scale, that is mild, moderate, severe. In Glasgow 13 to 15 is mild concussion, moderate 9 to 12, severe less than 8. Post-traumatic amnesia, that is less than 1 hour mild, 1 to 24 hour moderate, more than 24 hour severe. Post-traumatic amnesia. Loss of consciousness is less than 30 minutes mild, 30 minutes to 24 hour moderate, more than 24 hour severe. Loss of consciousness. Next is mechanism of cerebral injury. The mechanism of brain injury may be caused by shaking without acute blow or fall on the ground. Shaken baby syndrome. Blunt head trauma results in acceleration and deceleration injury. Brain is incompressible, but it is easily distorted. Injury: sudden movement of the head, linear acceleration or angular acceleration, rotational acceleration. Brain is subjected to shearing force parallel to brain surface, as well as a compressive and tensile force perpendicular applied to the force. Perpendicular applied to the tensile force is perpendicular to brain surface, parallel to surface shearing force. Okay, linear acceleration. In frontal impact is more dangerous than in side impact. Falls absorb part of the impact. Internal structures of the skull. Internal structures of the skull determines the most probable location of the traumatic injury. Traumatic injuries of the brain in closed head injuries. Skull surface of the anterior cranial fossa is quite rough. Furthermore, the most anterior cranial vault of the skull is limited in size. As the brain accelerated forward or rotated into the frontal areas of the skull, infraorbital as the brain accelerates forward or rotates in the frontal area of the skull, the infraorbital frontal lobes are impacted by the rough prominence above the orbiter, result in contusion or laceration or basis of frontal bone, frontal lobe syndrome may occur. The sphenoid ridges of the skull provide a significant structural impediment to the temporal poles. An accordion like compression of the temporal tips occurs. Damage to a number of important structures which a temporal lobe contain, that is amygdala, hippocampus, limbic structure, disturbances of memory and mood. Next is penetrating head trauma. In civilian situation, the penetrating head trauma by missile is less frequent than blunt trauma to the head. In military situations, Missile injury to the head is more common than a blunt trauma. Missiles are usually bullets, but they also include knives, crossbolt, and sharpener. Even nails and screwdrivers can become missiles. Thank you.